who are sick still aren't being tested for the coronavirus. Now officials want you to know why and what to do. Good evening and thanks for joining us. State officials are hitting on the subject of testing. We'll break down what they said in a moment. But first, we're answering your questions tonight. 3 Vigo County people have been confirmed cases of COVID-19, but many believe the true number is much higher than that. News 10's Sarah Lehman is live in our newsroom. She has answers from local health leaders.
Patrice, according to the Vigo County Health Department, at least 80 people have been tested for COVID-19 at Union Hospital. Now, that number of people tested and the number of cases could continue to rise, but you have to meet certain criteria to officially be tested. Coughing, shortness of breath, and a fever, all symptoms of COVID-19. But just because you have those symptoms, does that mean you're going to be tested? Barry Nickerson is the EMS Emergency Preparedness Coordinator for Union Hospital. He says it all depends on the patient.
If you're a young, healthy person who may have come into contact or believe that you may have it and you're exhibiting the symptoms, but you're relatively healthy, you're not diabetic, heart disease, those kind of things, the COPD that goes with that, you're going to be told to go home.
Nickerson says that means the majority of cases will be told to simply go home and self-isolate. He says when the outbreak first started, they were only testing patients at high risk who were being hospitalized.
Now we have the tent set up and we have a provider out there and we're seeing patients in the tent.
He says they still only have limited tests to offer. So right now you have to meet a certain criteria before you can officially be tested.
People call several times, I want to be tested, I want to be tested, but if they don't meet the criteria, we are standing fast on that. We are limited on testing supplies, and so we need to be very, very selective and careful.
And he says the most important thing is social distancing.
COVID-19 is very contagious, and we need to be very smart on our social distancing. We need to be very smart on isolating and not going and not showing up just to say hi to people. We just can't do that.
So what is the criteria to be tested? Well, according to the CDC, top priority is hospitalized patients and symptomatic healthcare workers. Second priority is patients in long-term care facilities with symptoms, people 65 years of age and older with symptoms, people with underlying conditions with symptoms, and first responders with symptoms. Live in the newsroom, Sarah Lehman, News 10, back to you.